starting to form in there. Okay? And if we allow that to progress, we can actually get to a point of fusion, right, in severe disc degeneration. And that's what we want to prevent. So here's a knee. We'd be looking at my right knee. Okay? Here's the kneecap up here. Here's the outside bone called the fibula, the tibia. Here's cartilage surface. Here's the meniscus in here. Here's the anterior cruciate ligament. Here's the medial collateral ligament. Here's the lateral collateral ligament. That stuff can get damaged, right? Because we walk on two legs and we kind of beat them up once in a while. Bone spurs, cartilage loss, swelling, pain, adhesion, scar tissue, deformity, and disability are related to the body's unbalanced attempts to restore and regenerate itself. The body's trying to do what it can to regenerate, but it doesn't have enough of the tools to be able to do it. That's where stem cells and amniotic allograft come in and begin giving it the tools, and I'll explain to you how that works in just a bit. In joints, osteoarthritis is the end result. So, you can see here the joint surface gets damaged cartilage. The meniscus can get torn in there. And let me just say this about meniscal tears. If a piece of meniscus, that cushion between the joints, is broken free and floating loose in there, it needs to be surgically removed. Your knee can lock up. But that's not the case in most of them. Most of the conditions that we see in our clinic, it's not a locking situation. It's deteriorated meniscus tissue, and that can actually repair. And I'm proof of it, as evident on MRIs. So the typical treatment cycle, we have joint pain. We do NSAIDs, non-steroidal anti-inflammatories like ibuprofen and Aleve and stuff like that. We have the same or increased pain. Do the non-steroidal anti-inflammatories fix anything? No, just mask the symptoms, don't they? We then need stronger NSAIDs. We need x-rays. X-rays are a good thing to see. Cortisone injections is the next step. Anybody have a cortisone injection? Okay, all right, we're going to talk a lot about that tonight. MRIs, important information. It's nice if we can have those. Arthroscopic surgery. I've had it done 3 times. This third time, didn't work out so good. Then surgeries. So let's talk about these non-steroidal anti-inflammatories, what they really do. The purpose is to alleviate pain at the nerve level or the brain or spinal cord level, lowering the pain, causing inflammation at the site. But the drugs do not address the cause of the tissue damage, thus the tissues just continue to deteriorate as time goes on. They don't heal, they don't regenerate anything, and they actually are linked to ulcers and heart attacks. 15,000 deaths a year just due to that. They're bad for your liver, hugely bad for your liver and kidneys.
Put me on flutamide just because I was taking so much, what is that, ibuprofen a day.
Sure.
And that's like $150 a month for a month supply.
We see that all the time, and you know, these aren't like vitamins you're taking, right? Your kidneys and your liver have to filter this chemicals out of your system, and they get damaged over time. So let's talk about these cortisone injections. We'll also talk about HA or hyaluronic acid or rooster comb. Anybody had HA, rooster comb? Okay, no? Okay. So we're going to talk about that in just a second here, and I'll explain it to you. So here's the deal. Cortisone degrades bone density and cartilage over time. The purpose of the cortisone is to go into a spot and decrease inflammation. And if you got one injection and it decreased inflammation and the pain just went away, wonderful. How many have had a cortisone injection and it didn't work? Okay. How many have had multiple cortisone injections? Right? Your doctor says you could only have 3 in a year, right? And I'll just explain why. Cortisone will eventually worsen and speed up the joint degeneration. It actually goes in and starts destroying tissue. That's why the doctors are trained to limit the number of cortisone injections that you're supposed to get. They're only temporary and they wear off. They can also increase and worsen systemic disease like diabetes. They can cause us to become more insulin resistant. Sometimes the doctors don't warn us about these things.
No, they don't.
No.
I get shots every 90 days in the shoulder.
Okay, maybe we can change that. Yeah, I can let Dr. Dixon talk about that.
Synvisc is one of the brands of HA.
One of the brands of HA, yeah, it's hyaluronic acid. There's a few different brands there. What does HA do? It's the chicken comb, right, from the rooster. And basically it's a WD-40. It's a lubricant that's in there. It works temporarily, right? It doesn't repair anything, but it just buys you time, all right? It's not unsafe, like cortisone is unsafe, but HA is not unsafe, but you know, after about 3 months, if it works at all, it wears off. It doesn't have long-lasting effect to it.
Okay. What if you have cortisone shots for like maybe it works for about 2-3 years?
If you have cortisone shots and it works for 2 or 3 years,
I got one. My last one was almost 3.5 years ago.
you're doing better than most.
But I exercise. I'm a personal trainer, so I'm in the gym every day too.
Right, so that's your saving grace.
I bike about 7 miles a day to help. That's my.
Right.
my
So
specialty.
you're allowing that to actually have beneficial effects because you got rid of the initial inflammation, then you began to rehabilitate yourself. Not everybody falls into that category. In fact, we don't generally see those kind of good results.
Because I'm the same case. I haven't had one in years, and it's been like 9 years. They told me I need surgery. I'm bone on bone on both of my knees.
Right.
And I walk okay. I just don't take no meds or nothing.
See, that's actually, you know, and again, they probably took x-rays, right? And they saw some degeneration in there.
Bone is bone on bone.
Okay, so-called bone on bone, which is not really bone on bone. It's
Yeah.
not a pancake, but it's a tortilla,
Uh-huh.
right? And the fact is, the joint is degenerated. And what's going to happen as time goes on if you don't take a proactive approach in doing something about it, like exercising, like amniotic allograft. See, it's going to continue to worsen, isn't it? But as soon as you start doing the amniotic allograft injection, now you've got the regeneration that begins. And that's what we're going to be offering you tonight.
Where do you harvest yours from?
I'll get into that in just a second. So that's a great question. I'll get into it in detail in just a second. So surgery. If you got weak stomachs, look the other way, look to the ceiling, look down at your table. I'll just tell you, when you go into doctor's office and they say, well, we're going to do this procedure, and they have this drawing there, it's not the same as like a real picture. So I'm throwing up a real picture because situations don't always work out so well. All right, this is what I've had done 3 times. And I'll tell you, 2 times it was necessary. Why? Because I had cartilage broken loose and floating free in there. It needed to come out. The medical establishment does a great job when their work is needed. But sometimes they don't offer you other opportunities. And I want to begin to do that for you tonight. Then there's knee replacement. Then there's hip replacement. And there's problems with these. According to the American Academy of Orthopedic Surgeons, the 30-day mortality rate for total knee replacement is 1 in 400. 1 in 400 people die from knee replacement.
Sir?
Yeah.
Like, so my doctor told me I had a ACL replacement a year and a half ago, and on on my other knee, I got severe arthritis. He said bone on bone. I mean, I
Right.
run 2 miles every day still at the gym, even though
Okay.
he tells me I shouldn't be. And he says my next step is knee replacement, but he's trying to put that off
Good. I'm
as
glad.
long as possible. But like,
You-
I play softball.
Okay.
You know,
Right.
I'm starting to feel it. Like,
So here's a young man, can I ask how old you are?
40.
You're 40?
Yeah.
Okay. So let's say he gets a knee replacement. How long do those knees last? 10 years, maybe 15 years. I play ball with a guy, or I used to play ball with a guy. He retired 2 years ago. He had a knee replacement 2 years ago. And we just found out 2 months ago that he needs another knee replacement after 2 years because it doesn't work. Right? It happens. We just had somebody in the office last week that got an infection in her knee replaced knee. They had to take the knee replacement out, keep her open for 6 months without a knee in a wheelchair because of the infection. And then, what's that? Call Schwabel, Getz, and Sieben. Yeah. Yeah. We've got an attorney who's going to be coming in with a Brad hip, and he's walking like this. He says, I'm not going to go in and get a hip replacement because I've represented too many people for bad hip replacements. Right? That's Todd from Clinic Doctor. Yeah.
And if I don't run, my knees they hurt even worse.
Sure, you're not.
Stiff.
It helps get the nutrition in there. So hopefully this lady will get some care from us, and because right now her replaced knee on a scale of 1 to 10, 10 being the worst pain, she's a 10 out of 10. Yeah. And we just had somebody else who was going to be here tonight who couldn't come because she had the same situation, and she couldn't make it here tonight because she's in too much pain. So there's other complications with this. Now, let me just say this. Sometimes knee replacements go okay. Has anybody heard of successful knee replacements? Yeah, it happens sometimes, right? I know of people that have had successful knee replacements. But what if you can do something that will prevent you from having to have a knee replacement, or prolong even longer for a young man 40 years old? You get a knee replaced approximately now, and then again when you're 50 or 60, there isn't a third time. There's not enough stuff in there to get it together, right? It's too traumatic for the joints to get multiple knee replacements.
Does this program work for fibromyalgia too?
Fibromyalgia is a different condition. I can talk to you about that after, but it's more of a systemic inflammatory thing. And I'd be happy to talk to you about that. Okay. So there's other complications associated with this. And there's anesthesia risk, infection risk, bleeding risk, clot risk, pain and swelling, breathing problems, nerve and artery damage, allergic reaction to the plastic or metal, implant failure. So again, let me just be clear on this so that you don't get the wrong message tonight. I'm not here to bash the orthopedic medical doctors. They've worked very hard in doing what they're doing. They didn't get into this business to do harm or anything like that. They're just trying to help people, but they're trained in a certain way, right? And it's difficult because they're also handcuffed in how they're being how they have to treat. They're told by their clinics, hospitals, insurance industry, pharmaceutical industry, this is the protocol. Don't go outside that protocol, because if something happens, God forbid, to the patient, and you don't follow our protocol, you're in trouble. See, there's liability issues if you don't follow their rules. But sometimes things don't go so well. And there's painful rehab for months. My mother had both of her knees replaced. At the age of 70, she had to have her second one replaced. You talk about a painful ordeal to go through, to have hardware taken out and then put back in and rehab a 70-some-year-old lady. It was not a fun process. And sometimes things don't turn out so well. This kind of looks a little bit like our lady that came in this week, but she had a big old skin graft because this infection wouldn't heal, and they had to cover it with something. So it's not always peaches and cream.
I hear an awful lot of people in this chamber talk about those with disabilities, and us trying to do things to help them. So I'll be damned if we don't have the chance tonight to hear framework in for other states to be able to follow quickly.
Ethically, this needs to be moved forward. We realized early on physicians really need to understand the truth about stem cells. It's not science fiction, it's biology.
One of the joys of using stem cells is there's almost always lots of upside and no downside.
In the tens of thousands of administrations that we've given, there have been no serious adverse events.
I went into practice because I wanted to help people, not just put Band-Aids on people, but really get to the root cause and fix it, and that's exactly what this is.
Patient after patient after patient, continuing to see these miraculous changes.
She was back to training for marathon.